Now to the ongoing health crisis, the Kenya Medical Practitioners and Dentists Union has vowed to escalate the ongoing nationwide doctors' strike to include consultant doctors and their colleagues in private hospitals across the country. KMPDU Secretary General Dr. Davji Atellah has warned of complete paralysis of all health services, including critical care services, should the government fail to yield to their demands. The medics also directed medical interns to reject the letters from the Ministry of Health, posting them to various medical facilities on grounds that the remuneration does not meet the threshold stated in the 2017 CBA. Safina Cheng Oma with more.
Day 22. The national doctors' strike is still on. This follows a series of failed attempts to resolve the impasse. KMPDU Secretary General Dr. Davji Atellah has warned of a complete paralysis of all health services, including critical care services, should the government fail to yield to their demands. According to Dr. Atellah, beginning next week, things may escalate from bad to worse, following plans by the union to woo their colleagues from private hospitals to join the industrial action.
We are going to stop offering also private services that were offered before by consultants. And this will continue next week. We'll see how to make sure that doctors also working in private hospitals, like Nairobi Hospital, like Mata Hospital, like Aga Khan, they see the need to protect the profession. It's not an individual war. It's the war for profession.
The union leaders were speaking during a meeting with consultant doctors, including those working at Kenyatta National Hospital, who also offer training to clinical medicine students at University of Nairobi, who resolved to join the ongoing strike.
To pretend that we are working when those who are supposed to consult us are not there is fallacious. And we are fully in support of the initiatives that they engage in to sort out the health sector.
As of today, all the consultants will not be offering services just like doctors are out. And tomorrow we'll be in Moi University and MTRH to have the same rallying call. And what that means is that the clinical trainings in the University of Nairobi has also been suspended completely, beginning today, until such a time that the government will listen to the issues that we raised in the strike notice.
On Tuesday, State House Chief of Staff and Head of Public Service Felix Koskei announced a 2.4 billion shillings offer for posting of all eligible medical interns. He invited those eligible to pick letters from Thursday. In one of the letters seen by Citizen TV, the medical interns are entitled to a monthly stipend of 70,000 shillings, which is to be paid by the State Department of Public Health and Professional Standards. The letter goes further to instruct the medical officer interns to accept the offer within 21 days, effective from 25th of March 2024, and send a list of documents to the ministry. KMPDU has accused the Ministry of Health of acting in breach of the 2017 CBA by revising the figure down from 206,000 Kenyan shillings.
Have we seen the judges getting a pay cut? Have we seen the CSS getting a pay cut? So why pick on a doctor to get a pay cut and unilaterally push it down their throats? So that's an illegality. It's a defiance of the CBA. It's a defiance of employment laws. It's a defiance of international conventions.
Go read the 2016 internship policy by the same ministry, and they'll tell you what an intern does, how long they work, and how much they're paid. Then finally come wrap it up with our CBA, the article on internship.
We are hired help. It's not our job to resolve the health crisis in this country. We are available, we shall work, but on our terms.
The medical internship, they say, is only part of the 11 issues they insist must all be addressed before they call off the strike, which has disrupted operations in many hospitals across the country, with patients bearing the brunt. Safina Cheng Oma, Citizen TV.